Hi, I'm Dr. Bikramjit Singh Dhillon from Ludhiana Dental Center, and here we are in our X-ray room, the Center for Diagnosis. And here we have the OPG unit and the IUPA unit. We'll be talking about the IUPA unit later. Now first, let's talk about the OPG unit. This is the OPG unit or the Orthopantomogram. This is also known as the rotational radiography or the panoramic radiography. It captures a single image of the upper and lower arch and the associated structures, that is maxilla and mandible and the associated structures. Now it has variety of advantages. For example, broad anatomic area is covered in a single image. Second, the radiation dose exposure is very low. Now both these units, the OPG unit and the IUPA unit, both of them are AERB norms approved, and here at Ludhiana Dental Center we have got the highest quality equipment, so it's safe for the patient as well as for the doctor. Next, this is very convenient and easy to use. The total exposure time for the OPG X-ray is just about 14 seconds, and this can be used to take X-ray for the patient with the minimal mouth opening. Alright, now let's talk about the indications. When all is the OPG X-ray indicated? First, it is indicated for the pediatric patients or the young patients where we have got the mixed dentition to assess the development of the dentition. For example, we all can see in this X-ray over here, we can see the deciduous dentition which is present and the permanent dentition which is erupting. That is the tooth buds that are erupting. Next, it can be used to detect various dental anomalies. For example, cleft palate, the developmental anomalies can be detected with the help of this. It can be used to find out the fluid level in the maxillary sinus, which can be present in case of infections like sinusitis. Then it can be used to take the temporomandibular joint X-rays. That is, like you can see over here, this is the X-ray of the temporomandibular joint. This is the left side and this is the right side in the closed and the open state respectively. So this can be used to diagnose the various dental anomalies which are present with the temporomandibular joint. For example, we can have the dislocation of the temporomandibular joint for the patient. We can have pain or clicking or the fractures of the temporomandibular joint, or any other pathology can be diagnosed with the help of this X-ray. Now, sometimes we have multiple anomalies which can arise because of the pan or tobacco chewing in case of adults, or chocolate consumption in case of children. All this can be diagnosed in a single X-ray with the help of this OPG unit. Now moving on to the IUPA unit. Now this is the IUPA unit. This IUPA is taken with the help of a portable DC X-ray unit which we have. Now that portable X-ray unit can be taken directly to the dental chair where the patient is sitting, and the X-ray can be taken. Then the sensor is brought over here and is scanned with the help of this scanner. This processes the image and then the image is transferred to the computer. Like you can see this particular image, this is the image for the intraoral periapical radiograph. Now as you all can see in this particular image, this intraoral periapical radiograph records only few teeth at a time, but this records high amount of detail which is captured because only few teeth are captured at a time. So we can diagnose fractures or cracks in a tooth, or we can diagnose the presence or absence of decay in that particular tooth, and also we can find out the procedures. Like in this particular case, you can see the root canal has been done. We can find out whether the root canal treatment for that tooth has been performed adequately or not. So to sum it all up, here at Ludhiana Dental Center, we have got the X-ray equipment and the machines, both IUPA and OPG unit, which are the best quality, highest standards and AERB norms approved. That is Atomic Energy Regulatory Board norms approved. It is safe for the patient and for us doctors, and the image produced in turn are very high quality, which help us with a very good diagnosis. As we all know, without good diagnosis, we cannot have a good treatment planning.